Hi and welcome dear doctors. Welcome to Kids Covery, a pediatric initiative by me. I am Dr. Parv Luthra and I am your faculty in Pediatrics. So we are discussing the inborn errors of metabolism, right? And in inborn errors of metabolism, this is actually our 8th class which will be held on the topic of maple syrup urine disease. So before teaching you anything, just see this. This is a maple syrup urine, okay, maple syrup urine which is there. So of course maple syrup urine is in fact the most favorite question for biochemistry people, for pediatrics people, both of them. So what is maple syrup urine disease? Remember that it's a disorder of branched chain amino acid metabolism. All right, so there are some amino acids which are branched chain amino acid. All right, for example, valine is there, then leucine is there, then isoleucine is there. So all these amino acids have got a branch chain all these are the branch chain amino acids, and the metabolism of course will be called as branch chain amino acid metabolism. So what happens is that all these amino acids are going to metabolize with the help of branched chain ketoacid dehydrogenase. Okay, so branched chain, because of course all of them are branch chain amino acids, so of course the enzyme name is branch chain amino acid ketoacid. Okay, these are amino acids, so ketoacid dehydrogenase. So basically dehydrogenase is the enzyme in maple syrup urine disease. This you have to remember. Okay, maple syrup urine disease, DH you have to remember. Okay, this is actually important thing. Now dehydrogenase I have told you. Now what are the accumulated substances? All the branch chain amino acids like leucine, isoleucine, valine. All right, so all of these are going to get accumulated if the branch chain alpha-ketoacid dehydrogenase is defective. Okay, so what is going to happen? Because there is an accumulation of leucine, isoleucine, valine, etc., this causes a poor feeding, because whenever you are feeding the baby, of course these amino acids are going, and because they are not getting metabolized, the body rejects the intake of these amino acids. That's why the baby don't like to feed even. Okay, so why this poor feeding? Because whenever the baby is feeding, these amino acids are going inside. So that's why the baby tells, oh mother, I don't need the feed. That's why there is a poor feeding. Or even if it takes a feed, there will be vomiting in the first week of the life. Okay, now since the baby is not taking the feed properly, or even if taking is undergoing vomiting, so that's why there is hypoglycemia that's going to occur. So because of this hypoglycemia, there is lethargy, there is coma that's going to develop. What are the confounding factors? So my dear friends, remember that maternal fenugreek intake can cause similar sweet smell. So actually maple syrup urine has got a maple syrup is a syrup. Okay, so because of the accumulation of all these substances, the urine smells like maple syrup. Now if the mother is having an intake of fenugreek, please understand, if the mother is having an intake of fenugreek, this is important because similarly it is going to cause the sweet smell. Okay, the sweet smell can be there because of this maternal fenugreek intake also. So how will you diagnose? Simple hai, it's very simple. In order to diagnose, you will see that the elevated plasma and urine levels of leucine, isoleucine, valine, all right, all these are going to get excreted in the urine also. Okay, so people say, sir, if they are excreted, then why they are accumulated? My dear friends, understand, leucine in a normal individual is going to get converted into some XYZ product. If this conversion is not happening, of course leucine is going to get accumulated, although some part is going to get excreted out, but still the leucine is being produced so much and metabolized nothing that the net amount of leucine is very, very, very high. You got it? That's it. Now after that, the next point is that there is decreased amount of plasma alanine. Of course, because these leucine, isoleucine, all of them are there in urine, so urine is going to show precipitant test, and these amino acids can even go to your brain, and in brain they can cause cerebral edema. Okay, So of course all of these things can occur because of these amino acids. So you have to understand that there is increased leucine, isoleucine, valine, there is decreased alanine, okay, and because these are going in the urine, there is precipitation test, because they are going to lodge in themselves into the brain, so there is cerebral edema that's going to happen. So what will you give as a treatment? So you have to do a trial of thiamine, all right. So there are some patients who are responsive to thiamine, because if you don't know, let me just tell you, alpha-ketoacid dehydrogenase requires vitamin B1. So whenever you will give thiamine or vitamin B1, sometimes because of B1 deficiency also this maple syrup urine disease can happen, but in very rare cases. But still, if the possibility is there, we should give thiamine. And naturally in the acute stage, to manage the acute stress, you are going to give IV amino acids, okay, and in order to remove the load of leucine, isoleucine and everything, we have to do the emergent hemodialysis or peritoneal dialysis, all right. And liver transplantation is actually the definitive treatment, because these all enzymes like alpha-ketoacid dehydrogenase, they are present in the liver itself, right. So if I just summarize, the mnemonic is A blast. So A blast is a very important mnemonic. So A for it is an autosomal recessive disease, B for blast, branch chain amino acids, ketonuria, that's going to be there. So of course that leads to accumulation of leucine, isoleucine, valine and everything. Then lethargy is going to be there because of hypoglycemia. Then you have got dystonia, opisthotonus and all these things. If you can remember, otherwise not very important. Yeah, but sweet odor of urine is going to be there, and thiamine is going to be the treatment. This is something which I have already shown you, okay. So they can ask you the image based question also from this. So this is all about the maple syrup urine disease. I hope that the retention is getting stronger day by day with our videos. God bless you. See you in the next video.